Okay, Jackie, we're ready.
Okay, well, good evening, everyone. Thank you so much for joining us this evening. My name is Jackie Lurea. I'm the president of Alexina Consulting, and I'm so pleased to be with Fort Lee Public Library once again tonight. A very, very special presentation, our panel on violence against the Asian American community. At this time, I would love to say again, thank you for joining us tonight. We have prepared a very special, hopefully very meaningful and knowledge sharing session for you tonight. I would like to at this time acknowledge any of our Fort Lee Public Library board members and the mayor and council. I don't know who is on the line. I see lots of initials and such on my screen. So if you are here, we thank you for making this very, very important event happen for us. I will tell you, and kudos to Fort Lee, you are truly setting the stage for all public libraries, and I will dare say throughout the state of New Jersey and beyond, because of these very, very important events that you have been hosting. It has been my pleasure to be a part of this. I'd like to read a statement on behalf of the library. Conversations regarding equity, diversity, and inclusion issues can be difficult, but Fort Lee Public Library strives to be a safe, inclusive, and equitable space within the Fort Lee community for all voices to be heard. We aim to create and to host year-round programming that celebrates and represents the patrons we serve. We appreciate your continued support in our efforts, as well as welcome any feedback that you may have. So before we get started, I'd like to lay a couple of ground rules, which I believe will be put into the chat for your reference later. But, you know, when we gather the community, it's a very, very exciting time for all of us. But, you know, when we're talking about subject matter that is as compelling at the very least, but could be very sticky, I just want to urge everyone to remain respectful and professional in this setting. You will have the ability to put questions that are going directly to our behind the scenes awesome hosts. So please feel free to use the chat for comments and questions. But again, we ask you to please be respectful. We will try to get to as many questions as we can at the given time towards the end of the session today, which is planned to go to about 8:30. But I have to say that in the past, and because we have so many great people and engaged people on these calls, that we aren't able sometimes to get to all of the questions. So we will ask, and I will ask on behalf of the library and our panelists to please just be patient with us. And if you don't get your question answered, we will certainly do everything we can to get the answer to you in due time, all right, as soon as we can after the conclusion of this. So we, as you may have heard, we are recording this session. So if you have any issues with that, I would suggest that you remain off camera or take your name off of your panel, but it is being recorded and it will be posted, I believe, on at the very least the library website. So thank you so much for allowing us to record it and to have it forever in our history. So thank you so much. So tonight, it is my absolute pleasure to not only introduce to you a good friend, but probably one of the most accomplished human beings, especially as of late in the last year and a half, going on more than that now. Dr. Su Wang is, again, not only a great friend of mine, but she is the medical director of the Center for Asian Health at Saint Barnabas Medical Center. And I'm just going to hand it right on over to Dr. Wang because she can tell us why she's sitting at this table and share with us what's been going on in her world when it comes to this subject matter. So Dr. Wang, please.
Thanks, Jackie. And thank you especially to the Fort Lee Library for hosting this. I have to say, when I heard that you guys have a librarian focused on diversity and inclusion, I said, we need that for our library. Like, what an example you're setting And I have to say a shout out to all librarians. I have to say our hospital librarian actually did a feature on Asian American racism and asked for a lot of books that I thought that she asked me for books that I thought would be good to display. And so I just think it just shows how everybody can do their part and everybody can be an ally in this. And sometimes your allies come out at the most unexpected places. So when Jackie in the library first approached me about doing this, I said, well, I'm just a doctor, like I'm not an expert on racism. And I think maybe a lot of you in this audience, if you're Asian and people have been asking you, how do you feel? You know, what do you think about this? All of a sudden we've been thrust into the spotlight. And I would say, you know what, we should own it. You know, we are experts of our experience. And I think this is where we come from, is being able to share our experience of being Asian in this really amazing and crazy time. We need to, there's a lot we're processing, but it is our own experience that I think that has the most worth and value. So I'm honored to be here. I'm really excited about hearing from the other panelists too. So I will do my little piece, and then will be a great discussion following that. So I'm going to talk about kind of what we're living, and I think kind of titling this reckoning and a healing for the anti-Asian American racism that a lot of us that we're here to talk about. So let me just move this to slideshow. All right, so you may or may not be aware that New Jersey has the 4th largest Asian population in the US. I think it's pretty remarkable given how small of a state we are, that we have the 4th following California, New York, Texas. We have more Asians than Hawaii. And so this is very, very relevant to our state and our neighborhood. Fort Lee obviously is in Bergen County, and you can see looking at these like pie charts, basically the bigger the pie chart, the more of an Asian population there is in that county, and then they divide it up by colors. So you can see in New Jersey, we've got varying amounts of Asians in each county, but definitely you guys are within one of the highest numbers of Asians. And this is data that's a couple years, probably a decade old, so it would be great to see what it looks like now, but I'm sure it's grown quite a bit. So overall, 1 in 10 New Jersey residents identify as Asian. And the other interesting thing is that our entire state is actually the 3rd highest in the US that is foreign born. So we are 21% of New Jersey residents are not born in the US, and that is pretty considerable. So the Asian American experience is unique, but it's also not completely unique, and quite a number of people who are foreign born have similar type experiences. So we have, I think shared experience and also allies with those other groups. So, I don't have to, show you guys all these headlines. I think this is something that we all have been experiencing this past year. I think we've just been seeing, as this headline says, a historic surge. It's causing a mental health crisis. It's not just it's definitely in the New York City area, the New Jersey area. There was some news coverage about how hate crimes in the US had jumped up 74%. Obviously the shootings in Atlanta, I think, were a real tipping point. And there was a lot more movement after that. And it just kind of set off what I think was a community outpouring of action, and a lot more collective, I think, collecting of data and resources. And if you look, it's amazing how many resources are out there now. A lot of what was one of the main issues was that we knew we only had the tip of the iceberg of the issues that were being reported. And so various outlets, one of them being Stop AAPI Hate, OCA started collecting online reports of these incidents. And this was really important because a lot of community members were saying they didn't feel comfortable going to the police to report these things. And so we started having community-based outlets to do so. And so some of these are just kind of really tragic. I mean, the more you read these, I think the more distressing they are, but I think it's important for us to document these, you know, because it just shows you these are real issues. And I think the thing that kind of has bubbled up is that so much of what's happened with the anti-Asian attacks are just completely random, right? And this is what makes people fearful, is that they're not targeted in that it's somebody you know or somebody who has a grudge against you, but you could just be walking down the street, going to the grocery store, in the subway, when somebody just decides to lash out at you, obviously in quite violent ways. We've seen punching, or, you know, box cutters, or with other weapons. So this is has been very distressing to everybody. But I think there's been a lot of, at least we've made quite a bit of progress in terms of documenting these, and at least moving forward with validating them. So on the healthcare side of things, you know, I think now also we are, you know, a year plus in COVID. It's good to actually see some data with this too. And so there've been a number of surveys. This was a survey done by pediatricians looking at families, and it was a survey that was distributed, you know, not just in person. I mean, I think the thing that's great about COVID is that while we're limited to in person, it's allowed a wider reach with distributing things online to people who may not otherwise step foot into your door, which obviously sometimes is a bias as well in terms of the surveys we do. So this just shows that amongst parents and kids that, you know, racism can come in multiple forms, right? It's not just the on the street physical violence, but there's obviously a lot that happens nowadays online. And this just showcased that, you know, I mean, it's distressing to see that some of these respondents were saying almost every day they were having some attacks that they were feeling were racist. And overall, it was like 1 in 3 of all respondents had reported that they had faced some sort of racist comment or some sort of racism, whether it be online, offline, in person, or you know, or indirect. So, you know, we all lived this too. It was a remarkable outpouring. I have, you know, amazing pictures. A number of us doctors and friends and people in the community helped organize a lot of these. One of our doctors lives in Fort Lee and sent me this picture. I'm sure a number of you guys were here. I mean, I was amazed. It sounded like an amazing turnout. You guys, you know, did it right with really getting a lot of partners and community members to attend. Some of these other ones, I went to one in Berkeley Heights, New Providence, where I live, and also Milburn and Livingston had some vigils. And, you know, I just think the flip side is that it's been really remarkable to see people come out. And I'm so proud of our young people being able to speak and take pride in being Asian. And as somebody who grew up in the US, in the South, my parents had come over as immigrants to study. I was born in the 70s. I grew up in a very white area. I definitely downplayed my Asianism and did not really take any pride, and actually was kind of, you know, minimized and didn't want to be Asian because it wasn't like my peers. So I think it's remarkable to see these kids at their age, teenagers, take pride in who they are. And what I saw in a lot of these stories is that they're holding their schools accountable for fighting and recognizing racism. And so that gives me a lot of hope that we're making progress. And with this generation, things are not going to be the same. We're not going to continue to brush things under the rug. But we are creating a lot of awareness, and this is our time. So I did have some people who came up to me, some of my friends who said, I don't understand all that, who are also Asian, but said, I never felt like people were racist towards me, and I don't understand why all this attention. And yet when I started speaking to them and we started talking about experiences growing up, you realize that they realized that they had experienced some things they just completely swept it under the rug and didn't want to deal with it. And I said, you know what, this is our time to do this. If we don't process this now, you know, we may never get this opportunity. So I just think that, you know, right now it's good to, and now that it's a little bit we're not in the middle acute phase of it, it's good for us to be able to take a step back. So just want to talk about in the hospital and at RWJ Barnabas Health, a number of us physicians and leadership, we have an End Racism initiative, which 2 years ago was very focused on what happened with George Floyd, Black Lives Matter. And we all as Asians stood up and did quite a lot of marching and protests as well. And, we made it clear that right now the Asian community is hurting. And it was really important for them as a healthcare system to be able to respond to that and support the Asian community, especially because there is such a large Asian community in number, and so much of the staff in healthcare systems is Asian. And so it was great to see our healthcare system step out and say that they stand in solidarity with the staff in our community, and to see this in social media. And we saw this obviously with a number of kind of institutions and community groups. And so it was, and I think it just helped for us to feel like we were a part of something and that we were being seen, right? A lot of this is just being seen and being recognized for the suffering that's happened. We also did something similar to this where we held a panel and talked about a variety of issues in terms of racism. A lot of it came from the physicians and also from different types of Asian groups. And I thought it was really important for it to be a broad group of representation: East Asian, South Asian, Filipino, Pacific Islanders. And one thing I had each of the panelists do is to really share one personal experience of where they had faced racism. And I think that is just what makes this not just a didactic topic, of research, but once you hear people's stories, even like, I'm just looking at Karen Lynn here, who's at the very bottom. She is the dean of the med school at Rutgers for global health. She's very accomplished. She's a family medicine doctor. And she shared how when she came to the US as a grad student, the admissions counselor told her, "We can't pronounce your name, please change your name." And little things like that people have just dealt with over time. And Dr. Gore, who's a pediatrician, she does incredible research. She's doing a lot of the COVID trials. She said she feels like she often has to prove herself over and over again, even though because she's like, I'm a woman, I'm a Asian woman. I know when I walk into a room, people look at me like, is she really the doctor? And she has to she's become used to the spiel of like, how do I, present myself so I am respected? So it's just been fascinating to see people's experience, of how they've overcome it and just haven't focused on it. But it's been very cathartic to share those kind of experiences. And even, you think about, what does Andy Anderson, who's the Caucasian man, what experiences does he have? It was very fascinating. He said that at some point he had his son had dated an Asian woman, and was very disappointed because his friends gave him a hard time about it. And it was he stood up, against his friends and made a point about it. And it was just a really compelling thing that he shared as an ally. So what do we do? I think as a Center for Asian Health, we have recognized that there's a lot of barriers in our community that keep people from getting access to healthcare. And so we started in 2013. Our goal is to really increase health overall in the community. So a lot of preventative care, mammographies, colon cancer screening. Asians have the lowest rates of all of this and high rates of diabetes. So we do a lot of screenings and linking people to care. So pre-COVID days, we did a lot of health fairs in person. This is just some pictures. It looks so weird to have people all bunched together with no mask. And then we have now since converted. So just like everybody else, we've done a lot of virtual type education during COVID. And so we talked a lot about COVID vaccines, a lot of questions about safety and such. This was in January, back when it first come out. Eye care, people worried about their kids on screens all day. So an ophthalmologist talked about that. And then one of the interesting things that we did was talking about social needs. So we started doing a survey, basically looking, this was actually pre-COVID, we started asking, hey, everybody's been talking about social determinants of health. We know health is really has a lot to do with socioeconomic factors. And so we had already pre-COVID said, let's do a survey. There's very little known about social determinants of health needs in Asian Americans. So we plan to do the survey in the office, basically looking at food insecurity, safety, housing, transportation, trauma, reasons people immigrate. And we handed this out. Obviously, during COVID, we had to stop handing out surveys. People stopped coming to the office. We modified it, and you can see, went from handing out about 20 a month of these or surveys. Obviously, we stopped. We started doing telehealth. We started doing virtual surveys during this time. So what was really what we were curious about is whether we would see an increase in needs, right? Because we did get phone calls about people having issues with getting food, having to get people to food banks, and obviously we said, this will probably impact health. We may not see this right away, but there's no way it doesn't impact people being able to get to the doctor, getting their medications, losing their jobs. And so this has been an interesting study for us. And what we did see, this is just looking at total things, is that there's actually quite a lot of people reporting interpersonal violence. And this could have been either verbal or actually physical. And it went across, we looked at people who spoke traditional Chinese or filled it out in simplified Chinese, and it was across the board. People reporting more violence than we would have expected. And honestly, as a physician, I can see why this is. We don't always talk about that. I don't always ask that question. And so for people to feel honestly that they can respond on paper, this opened up our eyes. And you can see there's some housing instability, food instability, insecurity as well. And this is something we still need to figure out how to address. But this is why oftentimes, the model minority myth really glosses over the needs of the Asian population. And we all need to be a little bit more attuned to what needs in our population might exist. So these are just the summaries. I'm going to keep going. In terms of COVID, yes, we need to be on high alert for monitoring these things and being able to respond appropriately. Jackie and I were on another call together, and somebody in the audience came back to me who worked for New Jersey Child and Health Services. And she said, you know what, we have all these programs for minorities, for Black and Hispanic population. We have nothing for Asians. And after she heard us talking, she said, I'd like to do a program for the Asian community and families who might be facing issues. So I think, these kind of platforms are really helpful where the community can exchange ideas with each other. And so we are not the only group that has shown that COVID has caused a lot of issues. Depression, anxiety, we've definitely, I think we're all aware of this. This has been a difficult time for young adults, especially with schools closed and so much of their activities becoming hybrid or virtual. And so 1 in 3 young adults reporting depression, anxiety, 1 in 4 reporting PTSD. This is something that there's going to be repercussions for years to come. And while traditionally Asian Americans don't seek mental health services, this is now the time to be really sensitive to it. If you look online, there's been so many resources out there. There's been free counseling offered for Asians. And we always tell people, you may not need it forever. You might just need to talk with somebody once or twice. But it's really helpful for coping mechanisms. And I tell people, even if you're not having, really, really hard time, everybody's having a difficult time during COVID. And, so a lot of these, we had a therapist talk to our office because we had such a difficult time knowing how to help people, and having a therapist work through us providers, just with breathing exercises, imagery, things that we tell ourselves in terms of what we could do was very helpful. So. All right, and this is also the time to go back to your doctor. We know that people have delayed care. They haven't been seeing their doctor. They skipped a year. Their blood pressure is out of control. Their diabetes is out of control. Now's the time to go, people. We don't know how things are going to look in the fall with Delta. If you haven't been to your doctor, it's the one thing I can leave you with is to not to skip your screenings. We definitely are seeing more cases of people with advanced breast cancer or colon cancer because they didn't go for their screenings. I just want to leave on a really good note in that, we have made some progress. It was amazing in New Jersey to see these gatherings happening on Zoom. Menendez and Senator Booker and Andy Kim hosted these virtual roundtables. Governor Murphy had a roundtable talking about Asian racism, and a lot of this training for bystander intervention has given people some really good skills about what to do if something happens, in front of them. And then finally, this was very monumental. Biden signed an anti-Asian hate crime bill, and this was completely bipartisan. It was one of the few things that both Republicans and Democrats signed on for. And I think this takes us to a new level where these attacks will be, legally, there's a law against them now. So that gives us as a community a lot to stand on and to move forward from. Finally, for all those of you who are here who are not Asian, we appreciate all the allies that we have. And as I read this, just about how we take, allies take struggles on as their own, transferring the benefits of your privilege. Speaking out for people who don't have a voice is really important, and telling stories, right? Amplifying and repeating these stories, and being able to stand up even when we're scared, owning our mistakes, and always being willing to learn, I think are critical skills for all of us. And being willing to learn. The fact that you're here shows that you're willing to learn, and I so appreciate that. And I'm going to hand us back to Jackie, and thank you for giving me the opportunity to share. Thanks.
Okay, now can you hear me? Can you hear me okay? Sorry, I muted myself just in case the dog wanted to start talking while you were speaking, Dr. Wang. So, and then I had to ask permission to be unmuted. So thank you so much. The information that, all that information that you just shared with us, so compelling, so disturbing, yet so hope-filled, as well as Chinese American myself, growing up in the suburbs, the way suburbs in Orange County, New York. I have to say that I was surrounded by some really great people who made me not even realize that I looked different from them. And I'll have to say, the personal testimony, as you had said, Dr. Wang, I have never been so afraid for myself until the last year and a half. And so that's the sad part, very much so for me and for my family. However, there's a lot of good that came out of it as well. Establishing allyships, just sharing our heritage, and just things getting done that may not have gotten done otherwise. So thank you, Dr. Wang, so much for all that insight. So you're an excellent keynote, which I knew you would be. So now I would like to invite the rest of our panel to come on. And I'm going to, as they're coming on camera and hopefully unmuted, I would like to ask each of our panelists. So we're waiting for Tak, if you could turn on your camera. There we go. Excellent. Hello, everyone. So thank you so much for joining us tonight and coming on to share your experiences. And I would first like to ask all of our panelists to share with our audience what brings you to this particular table tonight. Okay, so I'm going to ask Unju Hong. Unju, can you tell us, take a minute or so to tell us what brings you to this table?
Hi, everyone. My name is Unju Hong. I'm the immediate past president of Korean American Association of FLPL and currently serving as a board member over 8 years already. I started this organization. I started to participate this organization to teach my children first. This is my start. And now I'm here to help our community, lead our community, and ally together. That's the reason I'm here today. Thank you.
All right, thank you so much for joining us. Tak Furumoto, please. Why are you here tonight?
Okay. Good evening. My name is Takeshi Furumoto. They call me Tak. I'm a camp survivor. I was born in Tudor Lake segregation camp in 1944. Our entire family was locked up for 4 years for being of Japanese descent. And also, I am a decorated and disabled Vietnam vet. I served in the United States Army. I volunteered 1968 to 1971. I came to Fort Lee 50 years ago, right after I came back from Vietnam, and I started real estate business. And Fort Lee is like pea and carrots for me, and they had embraced me despite my background. I really appreciate that. I'm a board member of Japanese Americans, which has been in existence for 110 years, which has been serving our community. And I hope to share some of my experiences with you this evening.
Tak, first of all, I would just want to thank you for your service to our country. I am so proud to just even know you. Same with you, Unju. I'm so anxious, and soon Amy is going to introduce herself. I'm just so proud to be a part of this entire event. So thank you so much.
Thank
Amy
you.
Kotang, please introduce yourself.
Thank you, Jackie. Hi, I'm Amy Kotang. I am a resident in Fort Lee for the last 30 years. I choose to come back to Fort Lee to raise my family. I spent 20 years on Wall Street, and that experience have left me with many great insight into corporate America. But when I returned to the community after having my kids, I saw that there were a lot of needs within our community, especially within the growing Chinese community in Fort Lee, where I grew up. I felt that I was invisible as a child. I felt that when I was growing up, there really wasn't any representation for me. And I do not wish that for my children, nor do I wish that for any other Chinese American growing up in Fort Lee. And that had prompted me to help find the Fort Lee Chinese American Community Association in 2019, and timing could not have been more fitting with everything that's going on. Why am I here? If not now, when we speak up? And I am just so fortunate to be given this seat with Unju and Tak, who are far more experienced in organizing their community. So we have a lot to learn from them. I'm here to learn. I'm here to give, and I hope that this dialogue, it's difficult. The race work is petrifying for those of us who are on the receiving end, but for those who believe they're being accused or part of the majority. So we're here to have a conversation with you.
We sure are. Amy, thank you so very much. What an entree. What a powerhouse mother you are to make sure that your kids don't see what you saw growing up. So, and that is why we're all here to share experiences and to learn from each other and to teach one another. So let's get started. So here's the first question, panelists. Have you or your organization experienced an increase in violence against your community since the global COVID-19 pandemic? And if so, how have you addressed it? Okay, one more time. Have you and or your organization experienced an increase in violence against your community since the global COVID-19 pandemic? And if so, how have you addressed it? And I'd love to start with Unju. Unju, please.
Yeah,
and you can take about 2 minutes, okay?
Oh, all right, I will try. First of all, very beginning of the pandemic last year, maybe from January, maybe the year before December, many business owners, many Asian business owners started to have a hard time for their business because there was rumor. At the time, it was not the fact, but many people say that at that time that Asian carries COVID-19. So people started to hesitate to visit Asian owner business or Asian employees business. They hesitate to visit the Korean restaurant, Chinese restaurant, Korean operated business, Asian other Japanese or Chinese operated business. They started to not to go there. Even my husband, he owns small business in the city. He experienced, decrease of clients, number of clients from early January last year. It was, at the time, the pandemic didn't start at the time, but people already recognized Asian as virus carrier at the time. And then they started hate crimes. Hate crimes against Asian Americans in large cities have increased by 150% during the pandemic. And Asian American women and seniors, they are 2-3 times more likely than men to be assaulted. These are not just numbers. I heard from my daughter that her friend who is attending college was punched on her face in the middle of daytime street during the daytime with no warning. People yell offensive things to my husband in New York City. I was verbally assaulted by a man in Fort Lee. Oh my God, it's still scary. By a man in Fort Lee that had multiple reports against him from Asian women before. not just the thought, danger, but the fear caused by this hatred is violent too. I am much more aware of my race when I walk into non-Asian spaces, and I find myself uncomfortable and hesitant to speak my mind. That's it for now.
A lot of fear. Thank you so much for sharing all of your emotion with us. This is not an easy talk. No one expected it, but we certainly do appreciate you sharing your heart with us. So, Anju, thank you very much. So, Tak, what about you?
Well, this is not the first hate crime I have experienced past 77 years. The first was Executive Order 9066, which President Roosevelt passed, and they locked us up for being of Japanese descent. This has stigmatized us all our lives. And yet we still are patriots. We do work for this country, defend our country. And two, there was a Japanese bashing in the late 1980s and 1990s when Japan bought United States. I was in the real estate business, and I was part of this purchasing of United States, and I was actually bashed. In fact, the New York Times had covered the story nationally, and I was taken to Oprah Winfrey show with first Japanese American general, together with the Japanese American Citizens League, were able to voice our opinions that we are not the ones, that you must not mistake for us. So we're able to voice our opinions. And this time around, I faced this more closely. One of my salesperson who lives in Harlem, she was accosted, and she was a very strong woman. She was able to put this person, homeless person, in a prison. Not too many Asian Americans has done that, and that was good. While my son, who lived in San Francisco, was kicked in his leg and was accosted by one white person, but in fear of a reprisal, maybe owning a gun, he just kept on walking. He did not create a scene. Something like this has been happening. Only way we could stop this is by registration and showing our voice and doing something about it. I'll get to this later on this evening. Thank you.
Thank you so much, Tak. I really appreciate you sharing all of those stories. They are so very meaningful. So Amy, what about you?
I personally have experienced verbal assault since COVID. I am a runner, so I run on streets regularly, daily, and never had I been shouted at or make remarked at as often as after COVID, and to a point where I started reporting to the police once after a few incidents. But I think more importantly, in my community within Fort Lee, I know of at least one incident that was reported to the police. Within the Chinese community, there's a lot of chatter. We communicate through WeChat. That's our primary method of communications. And there is so much fear about where to go, when to go, fear about our elders. Are they going to be hit? Are they going to be slashed? And all of that restrict our mobility. It restricts our civil rights, and to a large extent, we second guess. Was that eye contact a normal eye contact? Oh, is there something more behind that? Was that gesture a normal gesture? Is there something behind that? And we start second guessing, and that deteriorates relationship. And I think that is probably one of the most poisonous daily interaction that we see, besides all the headline that's out there, is that it tears the fabric of a community. And if we, dare to utter that we felt racism, our concern is minimalized. It's brushed aside. You're overreacting. Is that true? You're sure that's what you felt? So there's a lot of that just dialogues play in our head, and we're no longer sure like what is norm, what is, is that a normal? Do other people experience that? Until we have this forum to talk about it. Oh, that is a form of racism, what we just experienced.
Amy, you're so right. And I find that I do the same thing. I ask myself, why are they looking at me like that? Why are they, and they could be, I don't know, admiring my earrings. I don't know. But, when someone looks at you, and that's the saddest part about this for me personally, is that I second guess people that mean no harm at all and are just maybe admiring my earrings, but that is the result of what has happened.
And I believe that's the kind of privilege that we're talking about here, right? For those who are in the majority, they have that privilege to never ever have to second guess.
Yeah, well, that's a whole other panel that we're going to have to do soon, most definitely. So thank you so much, Amy. Sue, what about you?
So it's interesting. We had, very similar type things, right? Around January, February, I think as a practice, we actually were, I feel like, ahead of a lot of the other practices in terms of saying, okay, we need to be ready for COVID. We were already getting news from Asia. People from China, like we're asking if we wanted masks, and, the community obviously did an amazing thing. Donating money, buying masks and face shields and things for us. But the flip side of it, I work in a building that has other practices, other primary care practices, and we could hear murmurings of people saying, oh, that practice has the Asians, you got to worry about that practice, they got COVID. But what was very ironic to me is that during the height of the pandemic, like some of these other practices were not wearing masks, we're not taking it seriously. And, it was a stressful time for us for a number of reasons. And so I think, but I think overall the Asian community has really stuck together. And like you're saying, it's been bad times, it's been good times. In our patient population, I have started asking people more, especially I have a lot of small business owners who are my patients, restaurant workers, how they're really doing, if they feel unsafe. And these are things I never, ever had to ask. But very similar type stories to what you guys are all saying. So I think it's just something we have to recognize, we're going through this time, just to be very sensitive to it. So thanks for asking that, Jackie.
Sue, thank you for your answer. And thank you for being one of those frontline people that were out there saving lives and putting yourself at risk every day, and yet also having to face this racism as well. So your challenges are something that I could not even begin to imagine, but I will absolutely acknowledge it. So thank you so very much. And so panelists, I have to tell you that we're going longer than 2 minutes per response. So I'm going to ask you to kind of speed up your responses a little bit, because I do want to get to all the questions tonight. Here's the second one. How can community members become allies to your organizations? All right, so let's try to keep it to like maybe a minute, okay? And Tak, you go first, please.
Yes, I'm a board member of Japanese American Association, and together with the Japanese American Citizens League 4 years ago, we had passed Fred Korematsu Day of Civil Liberties and Constitution in the city of New York City. Also, I belong to, I'm a member of Student for Solidarity. Mike Ishii leads this group. On February 19th, the day the Executive Order 906, which I had mentioned in the past, was passed, we do silent march. One time we did silent march from Donald Trump's building all the way to the church that our community attends. When the Donald Trump passed the Muslim travel ban, we have helped the Washington state by calling the governor and trying to make sure that children were safe. And more recently, we've been trying to help with HR 40, which is reparation for for the Blacks in this country. So we've been doing a lot of these things, and we're very proactive in this. Thank you.
You know what I love about you, Tak? I asked you how allies can help your organization, but you, because you are so awesome, just shared with us how your organization was such an amazing ally to others. So you're pretty amazing. So thank you very much. I appreciate it. So Amy, how about you? How can the community ally become allies with your organization?
I just want to point out at the very start of Stop Asian Hate movement, Mayor Sakolich and the police chief have all reached out to us, and just to make sure that we know that they are aware of the challenges that we're facing, and to have that tone at the top was super helpful. So that ally is incredibly incredibly valuable for us. The Fort Lee Library hosting something like this is an important ally. When someone who looks different from us shows care and an interest, it means a whole lot to us. Where can the average person help? Listen, I know that even for us to learn about, say, the Black Lives Matter, having a friend who is of that part of that movement will give you an insight. So we just ask our neighbors to hear us out. You don't necessarily need to agree our experience, but hear our experience and listen to us. In terms of the border leadership, representation, that's still very much in work in progress, whether it's at the town municipal level or at the county level or at the state level. We still do not have enough representation. So we have work to do. Our allies, we ask you, if you can lift us up. We don't want to just be invited to the party. We want to be invited to dance, and we want to learn to dance. So show us how to do this dance with you.
Amazing, Amy. We're all in this together, and I do love that party and dancing. That is just such a great analogy to where society is at right now. So thank you so very much. Sue, what about you?
So I think one of the most amazing things about what has happened is just creating space for people to share stories. So I think as an ally, you don't have to feel like you need to do something grand or big, but if you're in a position of leadership, just creating some platform. I think within our hospital system, the woman who directs our geriatrics program basically said, okay, in my geriatrics collaborative, which is across all 11 hospitals, usually, we talk about medical issues, but we want to talk about racism. And we would like people to share their stories. And so they invited me and a number of other individuals, and even some of the local hospitals just said, we want to do a Zoom, with you and some of the Asian physicians, just for you to talk about your experiences. And I think this is where the work of healing happens, and for people to understand each other is just by hearing those stories. And this is, how I learned about Black Lives Matter, and how hearing about my fellow Black physicians, like how they have to fear for their lives if they get pulled over by a cop, like those things like that have never happened to me. Hearing somebody else say that just really helped me understand what it is they worry about, right? And the things that we as Asians worry about is really not very different from other people, and they need to hear it from us. I think also the local allies, the local leadership has been really important too. So, support what everybody else is saying as well.
All right, thank you so much, Sue. And I meant to jump back, Amy, to something that you said. Mayor Sakolich and the entire council, I have the great honor of knowing the mayor personally, and have met some of the council members. And you're right, they are some of the most upstanding people, and that is absolutely what we need. We need to upstand together. So Unju, how about you?
I think we need to speak up against anti-Asian racism and discrimination, even when we are not there. We cannot teach everyone. We cannot educate everyone about the racism. You must help us. Our community needs to help us. So first of all, I think we need to teach our students about racism and sociology at school to raise a better generation. education starts at school, and American students should learn about the diversity of America and how to treat each other with respect. Teach others too. We need to. So I suggest our Board of Education should put certain program about the diversity regularly. Maybe each semester, we need to put strict course. They have to take the course, then we can educate our children first, and then we need to teach others through some kind of seminar, something like that, through the library system, something like that. And furthermore, I would love to suggest our mayor and council to organize a diverse committee to help our legislative mayor and council meeting, something like that, and law enforcement. They need to certain information, certain knowledge to help our community, Asian community. So I suggest to organize diverse committee.
All right, Unju, you know what I love about your answer? It's so multifocal. We're just going to hit on everybody, not only from different paths of learning, but also just diversity in and of itself. You know, it's not, this tonight is about Asian Americans, but it really is not just about us.
Right.
It's about
I agree.
everyone. And it's not just
Yeah.
about race, not just about religion. It's sexual orientation, it's experiences, right? It's age, right? So
Yeah.
yes, there you go. Thank you so very much. Okay,
Thank
question 3. What role do you believe the media plays in the recent occurrences affecting Asian Americans? And how can we work together as a community and with local news outlets to amplify the voices of Asian Americans? And that was a little long, but so the gist of it, how can we work with media to elevate, you know, the messaging? Amy, you first, please.
I think the media is a double-edged sword. They help us get the word out about Stop Asian Hate movement and make folks aware of it. It also spread the news about these incidents, and some of it may have created copycat behaviors. But most of all, for us, we felt that the way the media portrayed the Chinese-American relationship between country to country gets translated to us, who have no relationship with the country that we left behind, and we left behind for an obvious reason. And that we become the collateral damage of that relationship. And I think the media doesn't help in not clarifying when they do their reporting to bear some responsibility in the downstream behavior that bore from that reporting. So I think, you know, what can the media do better? I think the media definitely can do better in shining different lights about us. We contribute to our community. We don't, you know, we're not just a foreigner coming to this country. And I think that a more comprehensive reporting about our contribution to the country would help us. I also think that the media can also have more representation. I see more now across different media channels, even in our own neighborhood. The North Jersey media company had just recently hired Mary Chow, who covers the Asian American community up here. And I think that having someone like that is a trusted voice for us to go to and be comfortable that there's someone who understands what our concerns are and reports from that perspective.
Great. Thank you so much. Thank you. And there's a lot of talk about Amy Chow. What is her first name again? I'm sorry. Mary Chow. Yes. So a lot of buzz about her. So she's got a lot of work to do, but thank goodness she's there. So thank you so much, Amy. Sue, what do you think? What about media?
I completely agree with Amy in terms of it being kind of a double-edged sword. I think I want to also mention that we have a whole nother level of media. We have social media now, right? So we have not just the mainstream news, but we've got people talking on Twitter, Instagram, Facebook, and I think it's been remarkable because it's been an opportunity for the Asian community to get together and make be a voice, right, amongst our peers and our community members. And it's been neat, on Instagram, you see all these Asian leaders, Hollywood stars, people who are, usually not in the space, really being vocal advocates. And they've done, one of them was able to help find the perpetrator that attacked her mom's, her mom on the streets of Queens. And, so I think that's been really positive to see the community together. I have to say, I posted quite a bit on my own Facebook feed, and I had friends come to me from, like I said, I grew up in a small town in Florida, who said, we had no idea, we acknowledge that we are ignorant. We don't know what your experience is. Would you come on my podcast and share with us? And that was just really healing for me, but also just, great for somebody from my childhood to say, hey, I want to learn more. So it's created some opportunities, within our own networks to further all of us. So I encourage, more of that to continue. And I think that's been very positive.
And so you just pointed out how very powerful social media is, because that's why we reconnected over this whole anti-Asian COVID, that because we are Facebook friends and I saw how active you are, I'm like, I have to talk to her. And so we've been talking pretty much constantly since. Right. So thank you. Thank you for all of your activity. Unju, what about you? What about media?
I think American media is very guilty in spreading anti-Asian hate that has affected our communities. Racist and violent language describing one Asian country affects all East Asian Americans, because most Americans cannot tell the difference between us. For example, in 1982, American media blamed Japanese success in the car business because of their discriminating language. 2 white men in Michigan were convinced to harass and murder a 27-year-old Chinese man named Vincent Chin, thinking he was Japanese. They yelled racial slurs at him and beat him to death with a baseball bat. Anti-Asian racism does not come out of nowhere. It comes from racist articles and racist leaders like Trump. The media must be very careful with their language and the message they tell to the public, especially today with China and COVID-19, because that does not negatively affect any government. It affects our own Asian citizens in our own country. Articles that call Chinese people bad eaters and COVID-19 carriers causes Asian American people to be harassed and harmed, and Asian American business to become bankrupt. I think media, they have to be careful to mentioning about this message after all. Thank you.
Thank you, Unju. Very, very true words. And I think the theme that I'm hearing tonight, as it should be, is tell the whole story, not just one perspective, tell the whole story. So yeah, so Tak, what about you? Media.
I agree with everyone. Mass media must find the truth. It could go either way. Like, for example, Japanese bashing took place 1980s, 1990s, and Chinese, not Japanese, got battered and killed. Again, mass media plays an important part. The one major mass media boo-boo was done in 1942. The information about the Japanese American were fabricated. They should have found out the truth at that time. It took 35 years for the truth to come out, where they had fabricated that the Japanese Americans were a menace to the entire West Coast. That was completely false. And it even took American Supreme Court, US Supreme Court, 75 years to rule Executive Order 9066 unconstitutional. I wish mass media would find the truth and report all these truths to everyone. And sometimes, well, this time around, I think when Donald Trump says, well, it's China virus, well, at least mass media was able to help subside this a little bit. So again, it could be a plus, it could be a minus, but we as a citizen, we should be proactive and police whatever happens to the mass media. It is a very important tool that we have. Thank you.
All right, Tak, thank you so much. We're now going to go into our Q&A, and I invite the audience again to please put any questions that you have into the chat, and they will, our behind the scenes geniuses will feed those questions to me. So I do have a question, and this could be for the entire, whoever would like to answer it. And actually, I think it would be great if all of our panelists answered it. How do we, or how do Asian Americans get over this fear of speaking out and standing up for oneself? And I dare say that for anyone who feels that they're being pushed down, who feel that they're, you know, that they're being, their voices are being cut off. How do we get over that fear? Who would like to take that question first?
Okay.
Yes, Tak, and then we go to Amy.
Yeah.
Thank you.
This is America. This is where we live. And we cannot live in fear. We have to be proactive. We have to fight for our rights, our civil liberties. And the Constitution is there. So I believe, you know, you do have to take back this country. You cannot sit back and hope things going to happen will never happen. And as an American, we really have to fight for and safeguard our country. We have to watch out for the politicians. We have to be watchdog for them. They're our servants. And we hold the power, actually. Yeah.
All right. Well, I think, Tak, I think you should run a meeting for us and teach us how you do what you do, standing up for our country and being so strong. So, and so proud. So yeah, thank you very, very much. Amy, what about you? What do you think?
I mean, knowledge is power, right? And by knowledge, I don't mean academic knowledge. I mean, knowing what to do when you're harassed. Fear will always be there. Fear comes also with humiliation. And those two elements together are incredibly debilitating. So to overcome that is to know what tools you have, and how to use those tools. When Stop Asian Hate first started, we partnered with NJDOJ to host workshops so that we can teach our community, educate our community how to report a crime, and also share our experience. In my own reporting, I found out that reporting is not easy. What gets categorized into a hate crime is up to the officer who takes your report. So knowing what recourse you have if you don't get to the results that you want, how can you get folks to help you? And this is to our second generation. Our first generation do not have the language to help them. So the onus falls on us, that we have the pen to use as a sword, that we can use email, we can pick up the phone. We know that our elected officials are held accountable. And to have even FLCA or KEFA or the Japanese community, number speaks value. And if we can't get to if the individual cannot find the result that they want, that we go to a body that can help us, whether it's our elected official or a community group.
Mm-hmm. Amy, thank you so much. You know, you said something before in your prior comments regarding going out and running on the street, and that you have never heard so many racial slurs, and that it had happened several times before you decided, all right, I need to start reporting this. What was that went through your mind that said, all right, now that's it. I have to take action now. What was that?
It was just getting frustrated that someone can just feel that they have easily dish out something to install fear in me without any repercussion. That for them, it was so easily dish. So when I filed a report, I said, listen, I'm not looking to get anyone in trouble, but I want that person to know when they do that, they install fear in me. I'm their neighbor. There's no reason for them to do that to me. That what they thought is funny, or whatever their intention is on the receiving end, that's what I got. I want them to know that. And if this is how they were raised, and if this is how they would like to treat their neighbor, they need to know that's what they did.
Thank you. Thank you for sharing that. How about Sue or Unju? Yes, please, Unju.
Yeah. First of all, to make people report or speak up about the racism, I think we need to make them believe there are listeners who can help. There are people who can help them. So as I mentioned before, I strongly suggest to organize a community diversity committee, including our professional attorney who can advise them, including our community leader who can listen to them, our elected officer who can legislate, those rules or make resolution about those incidents, or law enforcement who can help them directly, teachers who can educate our students, parents. We need to include everybody to help them, to make them believe there are people who can help. That's my answer.
Perfect. Perfect. Again, multifocal. I love that.
Yeah.
As many different avenues as we can take to get to the wanted endpoint. Excellent. Excellent. Sue, what about you?
I think one thing that's helped, because I think so many of us have gotten used to, or easily will brush things aside, but I think thinking about what this means for a community, for me as a mother, really thinking about, I don't want my kids to have to put up with this, right? I don't think it's okay for our kids to allow this to happen. And so for me, something that happened like a year ago, I was at the mall, in line for something, and there was some confusion about, which cashier was where, and some woman in line with me made some snide comment that I didn't understand English, or I didn't speak English. And, I think in another life, maybe before I wasn't a mom, I may have just brushed it aside or ignored it, right? We ignore so many of these comments. You get tired of this, right? You get tired of being the perpetual foreigner. But my son was with me, and I said, I shot back something to her that, my English is perfectly fine. I don't want my kids to be the ones who just feel shame about being Asian. So I think doing it on behalf of our entire community, our families, is really important. I think this also brings up the point that bystanders are really important, and part of being an ally is being willing to step in if you see this happening right in front of you. One of the things that you hear in interviews by people who have suffered these things in public is how disappointed they were that nobody in the subway did anything, right? People on the street ran away, nobody stopped to help them. So we need to all think about what we would do in these situations, and it doesn't have to be accosting the attacker. It could be something as simple as making a racket, distracting the attacker, they say spilling your coffee, dropping your keys, calling the police, recording it. These are all things that help the community not feel alone.
Yeah. It is kind of shocking, I find, that when these incidences happen, and the one that comes to mind is when that poor woman was just so brutally beaten outside of that hotel. And those security guards and delivery men, whoever they were, just shut the door while she was just being pulverized out on the street. That, in other situations, that people have the wherewithal to videotape it on their phone, but then that's it. No action is taken. And it's just, oh my gosh. And I think to myself, all right, what would you do? What would you do? What is the right thing to do? And man, right now, if I had a hot cup of coffee, I'd be throwing that right in their face, right? It's anything to distract, anything to get them off of the person who's being accosted. So yeah, absolutely, absolutely. So so here is my final question, and we could take a little time on this. What would you say is the key take home for our audience today? Okay, what is the key message that we want to send the audience home with? So Sue, I'm going to start with you, please.
Oh man, give me the hardest question. I think, it's funny, I remember we were going to do this panel a little earlier this year, remember? And then we ended up having to move it. I think one of the things that this is reminding me is that we need to keep talking about this, right? Like these, it's not gone away. I think obviously it's not the hot topic now, But we still have a lot of work to go through, and these stories that I'm hearing from all of you are so important to hear. And so I just think these conversations need to continue throughout the year. You know, our kids need to hear us having these conversations. It should be an evolutionary thing that where we progress. And obviously we have some new bills in place, but there's more that needs to be done. I think the repercussions of what have happened are really going to last quite a while, right? In terms of the trauma that people feel, there's still quite a lot of healing that still needs to be done. So, keep moving forward would be my message.
Sue, I love that statement, but I love that you keep bringing family into it, and how you behave in your home and what you teach your children and the example that you set for your children. Let's just scream that at everybody, right? Because if you're the bully, somewhere along the line you're learning that behavior. If we just start at home to say that's not good behavior, that's unacceptable. But then, as you said, if you're being bullied, that you need to stand up for yourself, because that too is learned behavior. So thank you so much for making our children the priority. And my kids are 28 and 26, so I'm still going to use that. I'm still using that method with them. So thank you so very much. Unju, what about you? What's the take-home message for our audience?
Based on census, Fort Lee is a city with a population of over 40,200 people with so many diversity. It's very fast growing city, and that's the 22nd largest city in New Jersey. I'd love to watch our city to be a role model in New Jersey, maybe in US. Diversity is about recognizing, respecting, and valuing difference based on gender, maybe color, age, or religion, disability, national or sexual orientation. I think we should, really respect and listen each other and try to understand each other, different culture. We should understand everything, and we should be, a listener and to respect each other. I hope our community can be most grateful city in New Jersey. Thank you.
All right, Unju, thank you so much. I love that. Great aspirations, most definitely. Tak, what's the take-home message, sir?
Well, this is our country. We are here to stay. We got to be proactive. We have to register. And also, education is very important. Bring the truth out. And this is our job.
Well, that was concise, but very meaningful. Thank you so very much. I appreciate that. Amy, take home message, please.
Sue said earlier, 1 out of 10 people in New Jersey is an Asian American. In Bergen County, 1 out of 6 is Asian American. So we should be leading. Fort Lee has the highest population of Asian American among all municipality. We should be leading in this discussion. We should be setting the example, and that's not easy. That puts a lot of onus on our shoulder. And racism is a very difficult topic. But I hope that everyone, as we leave tonight, we have more in common in our humanity than we do in our political and cultural differences. So if the focus is on our humanity and not on what we lean political, whatever our political temperature or religious temperature is, we'll be at a much better place. And lastly, when we do this work, sometimes it's a lonely place. 20% of the people, there's a saying, 20% of people do 80% of the job. So sometimes when you're, one of the 20% is a lonely place. There are 30 of us, 32 at one point, now we're down to 26. It's a small group of people who cares about this. And it's a lonely place to be, but it cannot, we have to keep going for the sake of our kids, for the sake of our community, for the sake of ourselves, to leave a legacy that's worth living.
Amy, thank you so much for pointing out what I feel is probably the most meaningful tool that I got out of tonight is celebrating and pointing out the similarities between all of us and not the differences. And not, you know, how can I be offended today? Let me see, how can I use that to be offended? And just let's just be happier, more accepting, more open, more inclusive people. And I think that will definitely lead us in the right direction. But you are so right. All of our panelists, our keynote, you're all right. We have to all do this together. We have to upstand. When we see things going awry, we have to verbalize and voice things when they're going also not just wrong, but when they're going right. You know, similar to what you all have been saying, that, you know, these are things that are going right. So let's celebrate those things together and let's grow those things and not concentrate so much on the negative, so that people will learn, we all will learn, and we will be a more harmonious community. So ladies and gentlemen, my audience, I am so sad to say that we have come to the end of the formal portion of our panel discussion, our event tonight. I want to say thank you again to Dr. Su Wang for being our keynote and an amazing panelist. Amy, Kotang, Unju Hong, Tak Furumoto. I have to say, you guys have been amazing tonight. It has been my absolute pleasure to be with you, and to our audience and to the Fort Lee Public Library and the Fort Lee Mayor and Council, just amazing people in Fort Lee, just setting the stage for a much more inclusive community. And I thank you for that. So before I close, I'd like to make an announcement, a couple of announcements. The next program that's coming up, Javier Avila presents The Trouble with My Name in celebration of Hispanic Heritage Month. So the Fort Lee Library is asking you to join Dr. Javier Avila on Zoom. It's a one-man show that blends comedy and poetry to shed light on issues of language, race, and equity. And I believe that if you go onto the website, unless someone just, yeah, if you go onto the library website, I'm certain that you'd see the registration information. I'm sure they will be pushing it out as well. Sarah just, or our behind the scenes magical team, just posted the poll. So we ask you to please, if you can, fill out the poll, and also that is the registration, I believe. Behind the scenes, Sarah, can you tell us exactly what that was, please?
Yes.
Is
so
that
you
that is
see
one?
that there's
Okay.
two links. Yep.
Okay. All right. So excellent. Excellent. All right. So 2 links. It's I'm a little challenged with talking and looking at the screen and reading at the same time. So I apologize for that. But I just want to say thank you all so very much for your time today and tonight. And we look forward to many more conversations, because as we all agree, this cannot be a one-time deal. It has to be a consistent, sustainable conversation and action, so that everyone in the community can be can move forward as one. And again, we don't need to all love each other, but we certainly need to respect and accept each other. So with that being said, I would like to bid everyone a safe and almost weekend. And a big thank you again to our keynote and our panelists, and absolutely and most profoundly our audience. So with that, I say good night. Take care.
Good night. Thank you, Jackie.
You got it.
Night.
Bye-bye.
Bye-bye.